Hey guys, Tony Maritato here. So I've got a great question that came in the Facebook group, Total Knee Replacement for Kind People. I'm going to read the question. It's about patellar clunk or a clunking in the knee replacement. And then I'm going to provide some feedback to anybody dealing with this kind of situation. So from Teresa, she said, I'm almost 7 months post-op from a right total knee replacement. I completed PT about 6 weeks ago. Everything was going great until about 2 weeks ago. I now have a clunking, catching, uncomfortable feeling around the kneecap with extension and flexion. I've done some research, possibly patellar clunk syndrome. I can't see an ortho for another week. Anyone have any suggestions on how to be more comfortable? Until then, I've been icing, heat, massage, still very uncomfortable. So I've had patients that have developed a condition like this. Typically, I find that there is some sort of change that happened, especially if you were doing really great for 5 weeks and then all of a sudden you develop this clunking sensation. It's important for you guys, the patients, to understand that there's a difference between a clunk, a tap, a click, a pop. These are all different symptoms that are associated with different conditions. Typically, when somebody tells me they have a clunking sensation, I do find that it happens to coincide with the underneath side of the patella. So as you go into full extension for your knee, pretend my finger is my knee. The patella is just kind of a floating bone. It's a bone embedded inside a tendon that turns into a ligament. It floats over the knee joint. It provides leverage and it provides protection for the joint. But as you go from knee extension to knee flexion, that patella drops into a groove and it actually does this little S curve through that groove and then drops down as the knee goes into full flexion. So if there's an anomaly under the patella or there is an alignment issue between the femur and the tibia, it's possible to start getting some clunking as that patella goes through the patellar groove and moves around within the joint. In terms of it being an emergency, a red flag, something to be really concerned about, the fact that you've had it for 2 weeks and it's not just absolutely searing, piercing pain would make me think that while it's frustrating, it's not an emergency room type of situation. You can wait to see the orthopedic. But if somebody is dealing with a sharp piercing pain, of course, the fear is there a fracture? Is there something wrong with the bone itself? I would immediately go to the emergency room. Outside of that, if we're looking for any comfortable position, I would tell you that there are probably certain things that you're doing, like maybe if you're standing and you start to sit in a chair, or you've been sitting in a chair and you're starting to get out of the chair, there's a certain joint angle that triggers this clunking response. Sometimes if you can change your foot angle, so maybe if you're naturally, your toes are pointed straight ahead, if you turn your toes in or you turn your toes out, it's going to change the alignment of the tibia relative to the femur, and it might put that patella in a different tracking path, which will avoid the clunk. You can also just, change the way you do things until you see the orthopedic. So if it's a right total knee replacement, if you remember back in the early days, you probably kicked your right foot forward and then sat down using your left leg to control that motion. You might go back to a motion like that. I can tell you personally, I've never had a knee replacement. I don't want to claim that I know what you're going through, but I know that there are some mornings where I'll wake up and my right knee will clunk and pop because of some cartilage damage that I have in there. And when it's bad, I will actually go down the stairs backward in the morning because I'm already so stiff and achy anyway, that if I go down backward, I don't get the clunking, popping sound in the knee joint that I would if I went forward. But definitely get in to see the orthopedic. It doesn't sound like it's something that needs an emergency room visit, but continue to monitor it and obviously change the alignment of your foot and ankle. That might actually reduce or eliminate some of that clunking. And if you eliminate it, it'll calm back down and maybe reduce some of the inflammation associated with it.